Hey, everybody, this is Munson Steve. This is, of course, Health IQ. And part of our Health IQ are actually giving you access to providers. Now, there's several things that we need to know and we need to understand. There's always a hesitancy to test, a hesitancy to go in and make a connection, a hesitancy to look at a healthcare provider as a healer versus a doctor, a healthcare um, imperative bias that exists for us that we're aware of. So we do the opposite of what we should do, which is actually lean in to our healthcare, lean into a provider, identify, go to whatever links that it takes. You want to have someone that you can have a little bit of compliance with. If they prescribe something to you, you are able to communicate what they're suggesting or actually administering through their ability and their training and their hope for you to get better and better care. So for me, there's one and only in Chicago. She clearly has clinics inside our community. She understands what implicit bias is. She doesn't see herself as just a doctor. She understands our community and loves our community. And we want to bring today a conversation about just healthcare and what we truly can do to kind of begin to heal ourselves and reduce the hesitancy that we have to lean into better health. I said this to one other than Dr. Maya 100.
Hello, thank you so much for having me, and thank you for all the work and the groundwork you've laid for our community and the things you continue to do. Thank you for having me here. It's an honor.
No, it's all a partnership. You know, you think about culture, and I say to people, culture is nothing without community. Culture is zero without community. We're not going to, if our young people can't see a community coming together, can't see media and doctors partnering to get out a better message, a continued message, something that we're waiting for others to do. No, we're going to do it for our community. And that's why I admire what you're doing. So we find ourselves having to get tested. So there's a hesitancy to get tested for anything. We have no clue, many of us, of what those key performance indicators are related to health. So we have no idea as a Black male when to get a PSA. We have no idea at 60 why you would get tested for myeloma. Why are those moments in time important for all of us to know about?
They're important for us to know about for a lot of reasons. The main one that comes to mind right now for me is when these numbers came out, when the studies came out, there were not a lot of us at the table, right? And so if there are not a lot of us, you hinted on it, if there's not a lot of us at the table being studied, but also if there's not a lot of us at the table making the communication possible, then when the communication goes out, it's in a way that was never meant to help or be directed at all to our communities, right? So you mentioned earlier, you were kind of talking about the way the healthcare systems communicates to different communities, right? And the disconnectedness. Going back about our history, I identify as an African-American or a Black woman. And so going back, when you look at our history, one of the ways where our people have been consistently manipulated and taken advantage of, not only in healthcare, but all over, is creating disconnect, right? Making us move in silos without conversation, without community. And if you can destroy a community, you can rewrite its culture, right? And so we are still connected to our ancestors. So that consistently that culture will kind of bubble up. But a lot of times when it bubbles up, it's, we hear, don't wear your hair like this, don't look like this. And then it's appropriated, rebranded, and brought back as an American culture. So when you look at healthcare, if I'm supposed to get PSA or my prostate check at 45, right? And 40 and 35, depending on kind of what's going on with my family, my history and things like that. But the person writing that message is going to be put on a website that our culture never checks. it's going to be communicated through journals that weren't written about our culture initially. And now we see a lot of writing about our culture, but it doesn't include our culture. The writers aren't from us. So if the message is coming out, it's just like me going into a space where Spanish is the first language and the only language people speaking English and thinking that what I'm saying is going to hit home with them, right? It's the same thing. So it's very important for us to be not only at the table when the communication comes out, but it's important for us to be at the table from the beginning, right? From the beginning. Nowhere in history do the solutions that ail any community. Nowhere in the history can we point to the resolution or whatever is going to heal that community coming from another culture or outside of that community. So that's what